Dr. Wolski, you mentioned of how you are for some reason different and very good at helping people in which have car accidents, car wrecks, and stuff like that, personal injuries, I guess. But you're also very, very specialized in workman's comp. What is the average patient you see there, and how does it go down? What's happening?
Well, I'll give you an example. We specialize in removing barriers to treatment. For example, we had a 45-year-old fellow who fell down a ladder at about 12 feet, and he injured his neck, shoulder, and back. And the complication or barrier here was his employer said he wasn't hurt at work, even though he obviously was. So he didn't have a check for a long time. He had to borrow from his family. His wife had to go to work. He couldn't get a doctor to treat him. We started treating him right away, and we were able to give him physical therapy and injections. The other thing we did is we referred him to a workers' comp attorney to get the weekly check he deserved and was due to him by state law. And so he got his back pay and his weekly check covered. He eventually needed surgery, and we were able to get his case accepted, and so the surgeons would go ahead and perform the surgery that he needed. He then got post-operative therapy, and he was not able to go back to his job. He was fired anyways. But he got what's called an impairment rating, 16% impairment rating. And what that did is gave him about a year of weekly checks. And then after, with his impairment rating, he had 7 years of checks because he wanted to go back to school. He got fired and he had to be retrained. So this gave him enough money to go back to school. And we're planning also to do pain management on him because he got very depressed because of all his financial problems as a result of his injury. And he is depressed because of his chronic pain and inability to work. And he's very deconditioned. So if he goes to a new job, he wants to be able to be in top shape so he can work 40 hours a week.
Right. And your treatment... beat the steroid, beat the things, because your treatment, one thing, talking to lots of doctors, for many, many years, I've noticed that, one way your treatment really, really differs is that you really, not just going and do something which makes the pain go away, which is, of course, very comfortable for most people, and they want fast results. And while you yet make the pain go away as fast as possible with whatever you do, it seems to be that, drug treatment is simply not your first choice. You do all the other things which will make the body functioning again. And what I didn't know is, how instrumental, helpful, and inspiring you are about, basically getting people their money, and because it's all important. Because in the end, the truth is, there's only one crime on this planet, and that is be totally broke. It's a bad situation to be in it, because yes, a doctor, even a priest for that much, or everybody needs money to do what they do. Otherwise, they cannot live and cannot help. But you nevertheless have found ways to immediately get a person in treatment regardless of what. That's quite a thing. I think people should take notice of that who watch this video, and because that can make all the difference in the world. And then a guy getting a year of check and back payment, well, again, besides getting well, huge difference. Thank you very much. Anything else you have to say on that subject?
Yes, we can remove the barriers, and we can get patients the weekly checks and the final settlements to compensate them for their injury. This is all according to state law, and they're entitled to it, and we can help them get it.
So you fight on that side for him also, not just go and that's you and your lawyer and you and your company. I'm here, I do the treatment, I get my money. No, you actually are well versed in fighting for the patients in that area as well.
Exactly.
So that the patient isn't a patient and a victim.
Correct.
All right. Wonderful, Dr. Wolski. Thank you very much.